Welcome to Hebe Medicare Cyprus podcast, the only podcast where science meets inspiration and where doctors become leaders in aesthetic medicine. At Hebe Medicare, we do not only distribute products, we create a place of knowledge, growth, and inspiration, a true destination for learning. Our mission is to empower our community of doctors with education, value, and the tools to bring the highest standards of care to their patients. In our podcasts, we are hosting the greatest leaders and top experts from the field of aesthetics around the world. And today I'm honored to host one of the most influential leaders in our field right here in Cyprus, and my dearest friend, Dr. Petros Giannoulis, a board-certified plastic surgeon. Hello.
Hello, dear Emily. I'm delighted to be here. I must congratulate you for the whole organization of this podcast and these seminars. It's very helpful for people to learn new techniques and expand their knowledge in our aesthetic medicine field.
Thank you so much. And it is my great honor to host you here with us today, not only in this podcast, also you came here to conduct a very interesting training about the number one, I think, aesthetic treatment in demand in the universe, the Botox.
Indeed, Botox nowadays and always was number one treatment that any person that wishes to change something in his appearance did in all medical practices all around the world. It is not going to be succeeded after. It's going to be always number one. That's why Botox is very important. To be the medical experts that do Botox in our days must be trained and must do everything correct, because the Botox is the first and the most, for most people, the one and only treatment that they want to go through so they could change and make better their appearance. So it must be perfect.
I think most of the people, when they start doing aesthetic treatments, they start with Botox.
Indeed. Globally, Botox is the number one treatment that makes this magnificent effect on the face and changes the face of a person. There is no other technique that can change the face of a person like Botox. And
so, for my curiosity and for the people that are only beginners, before we deep in the field and talk about more complicated things, what exactly is the effect of Botox? What do we want to achieve?
So we found out that a toxin that is produced from one kind of bacteria can create muscle paralysis. This botulinum toxin can create muscle paralysis. So they separated toxins in therapeutic levels. They tried it on guinea pigs, and they found out the units and the exact doses that can be effective in persons and humans' muscles. So they can create this paralysis, the temporary paralysis effect. So afterwards, it began to be effective on patients that had problems with neurospasms and muscle spasms and blepharospasm from ophthalmologists. And sometime in the 1970s, they discovered that it can make the wrinkles in the periorbital area look better. So it began like that. And they began to examine how many units we can inject in a person to create a nice effect around the eyes and the forehead to make the wrinkles almost disappear. And after that, it was a huge revolution in aesthetic medicines, that we didn't have anything like that before. So it began to be even more examined, even more analyzed. And nowadays we have for any person, a specific diagram that we do for this kind of Botox or this kind of effect on the face. And now we have so many techniques. So Botox is number one analyzed medical action, I would say. It's more analyzed than anything. Seems it's more analyzed than anything, any other medical. Our surgery is also anything else. So it's very important that we have something that is not permanent, it's temporary, and we can correct and create a nice effect
when needed. Yes. So before we are going to analyze the word Botox, first I want to hear a little bit and share with our audience some background about you, my friend, tell us a little bit.
So I'm a board-certified plastic surgeon. I was born in Greece, originally in Thessaloniki, Greece.
Best food.
Yes, indeed. It's a very beautiful city, and everybody loves Thessaloniki. And afterwards, I went to Germany after my medical degree at Aristotelian University. I went to Germany to follow my expertise in plastic surgery and in general in surgery. So after that complete time, I came back to Greece and I went to Athens to work in a hospital there and gain experience on difficult cases. As a plastic surgeon, we don't only do aesthetic surgeons, we treat also skin cancer and other type of cancers in patients, and burning patients after burns, and so that was my my time in Greece. And afterwards I came to Cyprus almost 3 years ago, and then when I saw this beautiful country, these beautiful people, and this beautiful lifestyle, I decided that I'm not going to stay in Athens anymore, because Athens is a huge city and you cannot like live your life easily. You lose so much time in Athens on traffic and waiting and all that stuff. So I decided to move permanently in Cyprus. I met a beautiful woman in Cyprus, so now everything is better. So my lifestyle I like in Cyprus is the same for all of us. I believe that we visit this beautiful island, these beautiful people.
Magical.
Mm-hmm.
Thank you for sharing.
Thank you.
So let's just dive in.
Mm-hmm.
Botox. I think that back in the days, Botox was very familiar in 3 areas, right? And these days, they're using it everywhere. So what has made this transformation, and what did they find in clinical evidence that is making Botox, like increasing the demand of Botox also for areas like neck, or maybe gummy smile, or changing jawline.
Or the facelift effector and
yes.
everything. So Botox techniques were analyzed through the years because of the demand of the people for better techniques and better results and effects on every kind of issue in the face. So Botox techniques were expanded to treat other muscles in the face and the neck area. So from time to time, through many analysis of the anatomy of the people and which muscles create problems, on specific problems of appearance, then we saw that a very nice alternative to surgery is the Botox, because during surgery we actually do the same thing. For example, people that have strong muscles in the glabella area, there is a technique that we do when we do blepharoplasty, that we can treat the procerus muscle, we can treat the corrugators, and we can dissolve these high tense of the glabellar muscles. And nowadays we don't need to do that because we have the Botox.
The Botox.
Afterwards, people that had this syndrome, the gummy smile, that have overfunctional muscles in this area of the face, were always treated surgically before Botox. And it was a procedure that had complications and never 100% successful, so it was a trouble for these patients. Nowadays we have the Botox.
Of course.
The techniques are so much analyzed and studied, so the techniques are safe now for the patients and solve the problem without creating any more problems.
I think that Botox is actually adding a very important value to the practice of any kind of doctor. For example, if you are a dentist, right, and you want to give a holistic approach to your client, to your patient, so not only treating his teeth or his gummies, also using Botox to prevent the gummy smile.
It's very important.
It's a holistic approach. It's like a one-stop shop.
It's exactly like that. Globally, the orthodontists and the dentists, when they have a patient that has some either gummy smile patients, posterior or inferior gummy smile, we have masseter hypertrophy, people that have the masseter muscles.
Yeah,
so
and you
big.
want to slimmer their face, make them look more feminine.
All these syndromes are treated by dentists globally, and that's why dentists are so interested to learn the techniques, study the anatomy, and resolve these kind of problems, because, as you said, it's an alternative to surgery because orthodontists that could perform surgery to correct such problems, nowadays they can correct it easily with Botox and the filler, and patients are happy and they have no complications. Everybody is happy with these techniques, and it's very important for the dentist to secure their knowledge in this area so they can holistically, as you said, treat their patients. Globally, it's like that everywhere in the world. The dentists are treating this kind of syndromes.
So if you're a doctor and you want to give your client a treatment, and you explain to your client that as part of the results he wants to achieve, you will need to make a combination between Botox to other products that like biostimulators or maybe volumizing with the cross-linked hyaluronic acid. So practical question. Can you do Botox in the same treatment with all the other fillers or biostimulators, or do you have to wait in between?
Very good question. So the general rule is that the Botox treatment is a long treatment. It's one-day treatment. The patient comes, we analyze the anatomy, we see our problem, and we inject the Botox units. Then we wait for the Botox to get effect. So after about 7 to 10 days, the Botox effect is there. So the anatomy changes.
Okay.
So after that effect, we can see what can we correct with a filler, with some biostimulator, something else. At the same time, it's generally not indicated to perform fillers together with a Botox. Firstly, practically, because if you inject filler, or volumizing filler or biostimulator, you must do some massage movements to spread the material. So this is forbidden when we do Botox. For example, when we treat the gummy smile, we treat it in 2 sessions, not in 1 session. The first session is the Botox. After 7 days, the patient comes back and we see the Botox effect. We see how the muscles are not so overreactive and the upper lip is a little bit lower, and then we can inject some kind of filler to find 100% of our result.
So when you inject a biostimulator or hyaluronic acid of any kind, you actually massage it later because you want the material to spread underneath the skin in the correct layer where you inject it.
Exactly.
But in the contrary, when you inject Botox, you do not want the material to spread and go to wrong muscles.
Exactly. The Botox treatment, for every practitioner, every doctor that performs Botox, they must be sure of the points that will inject, the spots, the units. It's one-time treatment. You cannot like correct or go outside and correct and put somewhere. It's one decision. You inject the material, the Botox.
So you need to know exactly what you do.
Exactly, yes.
It's one decision, one shot, no option to change or dissolve. So, doctor, we are in Cyprus, and I will tell you the truth. I'm especially excited today because you are the first Cypriot Greek doctor that is training our community. Until now, we hosted doctors from around the world, but as I saw your work during the time that we know each other in the last year, I was very impressed from your knowledge and from your philosophy and your techniques. And it's really a big honor for me that you're here today and training our community. I'm saying our because you're part of it.
Thank you.
And I want to hear, what do you think about the aesthetic medicine specifically in Cyprus? And what was the highlight of 2025? What we can expect to see 2026 ahead?
Thank you very much for your kind words. Indeed, we plastic surgeons, because we always study anatomy, and we see the anatomy in front of our patients, and through our training we always use cadavers and we see the anatomy. We've analyzed any kind of technique, and now we are sure for the techniques that we use. And this is an advantage that we must teach to other people also who didn't have this opportunity to come so close to the living tissues, to surgery, to cadavers, to this kind of training. So the aesthetic medicine in Cyprus is expanding. I'm very happy to see that companies like yours are bringing materials in Cyprus that are already globally very well known. And it's very important that companies should bring materials that are tested and quality products certified products all around the world to Cyprus, so the aesthetic doctors can use these kind of materials. If you see it statistically, when the aesthetic doctors use quality materials, they use high precision techniques, that we minimize the complications. That means that the people in Cyprus are becoming not so much afraid of aesthetic treatments, because nowadays we have perfect materials and the doctor should be training in the new materials, so the results are all natural, and the patients and the clients in Cyprus become more excited about performing aesthetic. If I compare it to the past, and my feedback that I had before I became a resident of Cyprus, there was always a fear in the Cypriot society that some aesthetic treatments could be exaggerating, some over treatments, and people were afraid of the over treatment. So nowadays, thanks, as I said before, to your company also, in Cyprus, we are bringing materials that are highly sophisticated. They are new materials, high quality, so the complications are not so much. And it's very important that you train your doctors to the use of the materials, because this is what happens globally, and it's innovative for Cyprus, and we must congratulate you for your effort, because as we always said, aesthetic medicine, when somebody does aesthetic medicine and injects people, it's not like a treatment that somebody can learn over a video on YouTube, a video on internet, and see, okay, I can succeed. Then we have complications, and then the people are afraid. And this is my feedback and my practice also, that people come insecure when they first meet me. So, doctor, I don't want exaggeration. Yes. Doctor, I don't want that. Doctor, I don't want that.
I hear it a lot.
So, always you comfort the patient. You say, okay, now we have natural results because we have fine quality products.
So this is where we're going in the industry. This is 5-10 years from now.
To answer your second question, this is the direction of 2026. The direction is the use of high quality materials, biostimulating materials, and the techniques should be so precise when we're using these materials, and the results, most important, the results must be natural. So everybody that handles aesthetic medicine realizes now that the clients, the patients wish natural results. They don't want any exaggeration, any results that produce the opposite reaction.
Yes, this is very true. Everything is going more natural. For example, me as a woman, my dream is to go without makeup.
Exactly.
And in order to do that, I need to work on the quality of my skin. Only the quality. The production of collagen and elastin and pigmentation treatments and everything to be more natural, so we can be more natural and use less makeup and less exaggerate with.
If we examine it from a perspective, or statistic perspective, so we see that nowadays in our field, the #1 operation is the facelift. Especially in the United States, in Israel, also people perform facelifts, because 30 years ago, we didn't have these materials. The biostimulators, the collagen stimulators, we didn't have these materials. So unfortunately, our beloved patients, the female patients, their skin became so surging, and the only solution now is a facelift. You can imagine your generation, you are young, 20 years after 20 years. So facelifts will be something rare, because the women today, they take care of their skin, the skin quality, their collagen production. So this anti-aging effect, this is the direction of our practice. So for 2026, the trend is natural results and biostimulation. Biostimulation is a very important thing because the science of aesthetic medicine has discovered that when we inject a hyaluronic acid volume filler in a patient, of course, everybody knows that this produces a reaction of a foreign body type reaction to our organism. So they had to find something to get along with this reaction of our body. So they searched for materials that stimulate the collagen production. It's easy to understand that if you inject in the deep tissues a volumizing filler, our body, our immune system will begin to fight it. This is happens with everything that comes inside our body. In years to pass, this had a result that the skin surface appeared to be like affected from this reaction. So the scientists thought that we should add something in the fillers that could create or stimulate the collagen production, so that the surface of the skin 1 year after, 6 months after, is not affected by the natural reaction of our immune system. That's why we have so magnificent things now. The materials, the polynucleotides, the exosomes, the peptides, we have so magnificent things that, thank God, they're created now in the laboratories and they are added on the fillers. So the final result is a natural result. We see a volumizing filler with a glowing skin, and this is the perfection. I believe in the aesthetic field, when we talk about fillers and volumizing, we reach our one kind of better age of any time. And we have the best materials. Now, of course, they will become even better through the years, but nowadays we have the best materials. So this should be communicated with the people, with the patients, that nowadays they must be educated from us about the materials, that everybody should know that nowadays we must use the fillers with the biostimulators together, a complication of the materials and not fillers alone.
I agree with that. And also with the thing that you said about in 20 years from now, people will age differently.
Yes, it's very important.
So, doctor, from your point of view, what would you recommend 1 or 2 tips for doctors that are starting their journey in the aesthetic field these days?
A very nice recommendation that we all had in our beginnings is, of course, study the anatomy and study the techniques, read about it, especially the anatomy. Anybody who has the chance to get close to a cadaver and see the anatomy live, it's very beneficial for the knowledge of what he is handling, which muscles he is handling, which result he wants.
So important.
And it's the number one education that the doctor should have before beginning with aesthetic medicine.
So first of all, study the anatomy well. Second?
Secondly, he must be always informed about the trends of the latest trends in the globally, I mean, in the aesthetic medicine. So if anywhere in the world the convention IMCAs are talking, and IMCAs are talking about this regenerative medicine with the biostimulators and all these techniques, somebody must be familiar with these new trends and not stay on the old techniques, like simple techniques like filler or old Botox techniques that we used 10 years ago. And they should be familiar with the new techniques and the new materials always.
Always to stay ahead.
Stay ahead and stay close to the companies that, like your company, they have so many magnificent products and should be educated on these products. They should analyze and read the details, get trainings, of course. It's very nice for opportunity for new doctors to have these trainings, ask their questions. It's always a familiar, so to say, environment, because we are all doctors, and this is their chance to ask whatever they want, whatever question they want, to a more experienced doctor. What should I do in this case, and what should I avoid? And I had this complication, why did it happen? And there is an answer for everything.
So if people want to look for an answer, if the doctors that are watching us now want to find you on social media, how can they do that?
So my profile in social media and Instagram is Giannoulis Plastic Surgery and Dr. Giannoulis Larnaca and Dr. Giannoulis. There are 3 profiles. People can see our results, our techniques, our videos. We have together also so many videos about training, about explaining techniques, and of course the plastic surgery field that we do, the breast augmentations, facelifts, and all
they can approach you through those areas and ask you questions and your opinions. And
mostly I get questions that people had some problems that they were not corrected, and they search for a more expert doctor to correct their problems and maybe complication from other treatments or surgeries. So everybody is welcome to answer anything he wants. We are here to help people. And this is the medicine, especially we are plastic surgeon. We are trained firstly to help the patients, afterwards be expert on techniques. But our main emotion is to help people find a solution to their problems, to help other people.
Such a great person. I enjoyed a lot this conversation with you, and thank you for coming.
Thank you very much. I must congratulate you for these training courses.
Thank you.
They are very effective in Cyprus.
Thank you for being with us.
Thank you very much.